Excellent. Hi, Ritesh. Can you hear us all okay?
Yes, all good. Hello.
Excellent. I'll
Greeting.
just do a quick intro while your slides are coming up. Uh, Ritesh joins us from NHS Kenton Medway ICB and will be talking to us about the GP Resilience Matrix, a strategic tool for targeted primary care support. And right on cue, there are the slides. Over to you, Ritesh.
Yes, perfect. Hello, everyone. Good morning. I'm Ritesh. I'm the lead analyst in Population Health and Strategy team at NHS Kenton Medway, and thank you for joining. And today I'll be sharing the GP Resilience Metrics, how we built a high-value legacy tool to improve flow, visibility, and decision-making in primary care, all through simple analytics. So why does GP resilience matter? So in NHS Kent and Medway and probably in other areas, you will see the increasing variation in practice resilience, specifically around staffing gaps, demand pressures, operational strain, or general health outcomes. And we lacked a single reliable way to see which practices were nearing risk, or to say were at the tipping point, and what the drivers were and whether support was needed early on. Decisions were being made on fragmented intel, so from dashboards through local dashboards or national dashboards and general emails and local intel. So we needed a shared view that could bring all this together, and that's why the GP Resilience was born. So initially we started as a proof of concept a few years ago and in Excel, and that became a success. So people loved it, and it did the job. And we had over 40 indicators, and I have done many iterations of it on Excel. I've tried many mathematical models and the scoring methods behind it. And at the end, we agreed on the Z-score transformation. And so, but maintaining over 40 indicators through different lenses and different data sources in Excel was extremely labor intensive. And also the users wanted a bit more flexibility, a bit more nicer visuals, a bit more better UI UX. And that's where we decided to shift towards Power BI. We also have a host of Power BI portfolio tools and dashboards that our users already use. So it was a good segue in terms of for them to move on from the trusted Excel to the Power BI version. And this is the quick screenshot of how it looks in Excel. It had fantastic features as well, obviously not as many as Power BI. So I'm going to quickly show you. So each practice would be banded in a category. So there are 4 possible categories: higher achieving practices, achieving, approaching review, and review identified. These categories are dependent on the number of triggers each practice attains on the 40 scored indicators. So there are 3 possible triggers for each indicator: positive variation, level 1, and level 2. So positive variation is if a practice is more than 1.5 standard deviations away from the mean in the desired direction, it's classed as a positive variation. Now this mean can be NHS Kent and Medway, which becomes the local benchmark, or England, which becomes the national benchmark for each indicator. For level 1, it's in the negative direction of being -1 to -1.5 standard deviation, and level 2 is anything more than -1.5 standard deviation. So only selected few executive decision makers have the flexibility to change the criteria, so they can decide to be a bit more lenient or a bit more strict. And all of this is dynamic, it changes. And we also have the dynamic element of including certain metrics in your scoring, which re-ranks the practices again. So this is based on the user, on the team they've come from, and the improvement program they're working on. So to remind, this is not a benchmarking tool. This is not a performance management tool. This is only a tool that identifies any practices before they tip over and help them with the support bespoke care package. So what was our aim? Our aim was more insight, less effort. So improving the UI UX, and that just reducing the friction between the user and actually making the analytical decision or just the general business decision based on the tool. So having a shared, reliable, repeatable product that could support early conversations and better flow in supports of the term. And how did we approach it? So we ran this as a proper analytical commercial product cycle tool where we use the Woodyard approach. So More on the Woodyard model, our colleague Shivan is presenting a talk on Woodyard tomorrow, so I highly recommend all of you to join that, 10:40 a.m. So the Woodyard model works in collaboration and does not work in terms of downstreaming work by passing on one step to the other. So there were clear roles. So there was data visualizations, population health management team, and clinical leads. We had product owners, technical owners, all of them doing their bit, and that helped us keep on track. And we had weekly check-ins, active group chats in the background, rapid iterations, and just not chasing perfection, but chasing the right insight and the golden truth that can be shared. The data side and the scoring engine. So as mentioned earlier, we have 40 plus indicators that are scored. These are normalized based on Z-score transformation. In simple terms, Z-score transformation is how far away is the data point from the mean in standard deviations. And the mean, again, can be local or national, depending on the indicators we have. And apart from these 40 indicators, we have also various indicators which are not scored, which are there for contextual information, things like CQC scores, deprivation scores, ethnicity data. And after these scores are standardized, normalized, they are color banded into insights, and the users can make decisions based off that. So what does Power BI enable? I'm sure most of us have used Power BI or Tableau or similar tools. You know all the beautiful things and powerful things they can do. So a bit more insights you can explore, not just beautiful to look at. So interactive filtering we have map views, which are incredibly powerful. You can see the clusters of emerging concerns and practices at PCN level, at HCP level, at practice level. And the users can also see the underlying tables, which builds trust and transparency and also reduces any dispute from the ground level when we approach with the care package further. So this is the Power BI bit, one of the screenshots. So there are multiple pages, many more filters. Again, similar concept we have where we have each practice in a final banding and the ranking score. So this score is basically a priority list for the action taker, where if you have a pot of money to go behind in an improvement program, you can use this to target specifically which practice to go make the call first. And you can further drill down deposit variations, level 1, level 2, and there are many other ways you can drill down this dashboard. Moving on to what the users have told. So we did a soft launch, and our key stakeholders, key users have given us incredibly positive feedback. Thanks. We are thankful for that, and also given us some constructive feedback, which we have implemented and implementing in our next phases. Moving on to what's the impact. So regarding the impact, the biggest impact is the earlier visibility. So instead of waiting for issues to escalate, population health management and clinical leads frame early supportive conversation and shared evidence base. So it frees up my time, analyst time, and frees up less spreadsheet maintenance, more interpretation, and more value. So we can directly contact the practices, help them with the right transformation pack. It could be S96, DES, and other care packages that we have. Moving on to the lessons learned. So the biggest lesson from Power BI to Excel, from Excel to Power BI, the other way around. We learned that getting the modeling right early on unlocks everything. It makes it a lot easier to implement new ways of presenting the data or new visualizations that the users require to make the decisions on a daily basis. So that saves a lot of time, a lot of DAX coding, clear roles, avoid confusions, so it prevents bottlenecks. The Woodyard approach for us have worked tremendously, and it makes the biggest difference. So it's co-working, not just passing downstream, not just passing work downstream. And we needed protected time with the business owners, so helps us keep the reality in check in terms of groundwork, how it happens at the GP practice. So that again is a good collaboration. So as the tools will also be used with clinicians. And what's next for us and the tool? So we are working towards a bit more custom filters, a bit more automatic refreshes, more category level transparency, and also helping adoption across ICS regions. So I've also presented around for the Southeast region, where other ICBs are also interested in this tool. So we are working towards having a collaborative way of working. And yes, we are already planning the next phase. That brings me to the end, where I'm happy to take any questions. I'd like to take a moment to thank my colleagues and co-developers, Dr. Ash, Clint, Sarah, and Siobhan. And with that, I'll take any questions that you may have.
Fantastic. Thanks, Ritesh. We've got a question in the chat. For analysts and data teams in the room who don't always feel close to decision makers, what's the one practical thing we can start doing tomorrow to have more influence on the changes you've described?
Yes, that's a good question. That's something I face pretty much every day. So the data does not lie. So as I mentioned, that there are transparent tables of raw data before being processed. So that cannot be denied when you're approaching people with decision-making tools. If you show them where they rank in terms of their peers and benchmark them against the local and national, unless the data is wrong by itself, there should not be any more pushback further than that.
Great. And how do you see analysts and business intelligence teams using the GP resilience matrix in practice day to day? Like, is it more of an early warning tool or a planning tool or a bit of both? Like, how practically are people informing decisions with it?
Yes. So it's a bit of both. So as an example, so let's say you get a pot of money for improving hypertension or cardiometabolic diseases outcomes. So you log on to this tool, you see what practices are in your radar, and you see that you try to marry other metrics into that. So be it deprivation, that helps you re-rank your practices, and then you can add on to more intel. You have soft intel columns where you can see if any other programs are running already on that bit, and that will help you reframe your resources and optimize it.
Got it. And I guess I'm impressed you've got so much buy-in for doing that sort of site level reporting. Like, have you got any kind of was there anything specific you needed to do to get specific GP surgeries providers, to buy into this, or did they kind of just get it when you presented the idea?
So I have presented this to the local medical council and also members of parliament. So it's been accepted through them, and through them I have bought the view and confidence of the GP practices. However, this tool is mainly for the corporate employees, where we build the care packages for the practices, and we approach them with the bespoke solution for them.
Great, thanks a lot. Let's see. I was going to say as well, like your quote, "more insight, less effort," feels like something many people on this call can take away and using their slide packs. That was a good line. Thanks a lot, Ritesh. That was super interesting. Loads of impact again. Thanks for questions as well in the chat.